This is Dr. Arti Gupta. I am consultant gynecologist in Mayo Hospital, Gurgaon. Today I will be talking a very common and relevant topic called polycystic ovarian disease, or commonly known as PCOD, which is a very common thing these days in young girls and women. So, 1 out of 3 women or young girls present with PCOD. So, what precisely is PCOD? How do you diagnose that you have a PCOD, and what are the symptoms? How you can present? So, polycystic ovarian disease generally presents. There are multiple things you can notice. One is irregular periods. When you start getting your periods very delayed, so less than 21 days cycle or more than 35 days cycle is considered a normal cycle. So at times you get periods twice in a month, or you get delayed period by 35, 40, 45 days, or maybe more than 45 days, where you are given a medicine by the doctor and then you bleed. So irregular period is one of the common symptom of PCOD. Second, suddenly you notice a sudden weight gain in things, and like you notice a sudden weight gain along with the irregular periods as well. Then there's a sudden growth of unwanted hair on your face, on your chest, on your back, on your arms, around your nipple area. So these could be a sign of PCOD. Then, if you're developing a dark patches below your neck line, over your backside of your neck, that is called acanthosis nigricans, this is also a sign of PCOD. What exactly does it cause a PCOD, and then how it develops in fact? So I'll just make you understand a little bit of it. Women generally have both the hormones, the female hormones and the male hormones. So female hormone is generally two type of hormone, which is called estrogen and progesterone, and the male hormone is known as androgens or testosterone. So women produce a very minor quantity of male hormone. When you have a PCOD, there is an excess amount of testosterone or a male hormone is secreted. Because of this excessive male hormone, you develop a lot of things. As in, this male hormone interferes with the egg development and the release of the egg. So, as a result, the ovary starts forming multiple eggs. So, when we do an ultrasound, these eggs look like a small balloon-filled structure or the cyst-like structure, which look like a cyst. This is not precisely cyst, but they are small eggs which look like a cyst, and that is where the term is coined called polycystic. Then the second thing, because of the excessive male hormone, the body becomes resistant to the insulin what it produces. So body becomes resistant to the insulin. So because of the high level of insulin, when we test, you have a high level of insulin as well. This male hormone can actually result in hirsutism or excessive hair growth pattern on your body. So which is what we see, the excessive hair growth on your face and unwanted hair, what we call. Then again, because of this excessive male hormone pattern, you can have a female pattern baldness, meaning you will start thinning hair on the male pattern baldness you can notice. Then the other thing what you can have is that central obesity or a weight gain. So you'll see that classically the weight gain is around your waist area. So now how we deal with this, how the doctor diagnoses it and how we treat it. So to diagnose the PCOD, the clinical history is very important, clinical history and examination along with. Plus, it can be combined with ultrasound, where the ultrasound can show the polycystic appearance with a particular stromal hyperplasia. Or we can go for a blood test, which will include all your hormone tests, including your insulin levels as well. So, after making a diagnosis of PCOD, here comes the treatment, how we treat it. So the most important treatment which you need to understand in polycystic ovarian disease is that you have to go on a lifestyle management where the diet and exercise play a crucial role. So you have to cut down all the aerated drink or carbonated sugar or carbonated drinks or sugar or excessive junk food. You have to come on a good diet, high protein intake, and take in time. So you have to eat a good diet and a balanced diet along with exercise. There's no shortcut to diet and exercise actually, so you have to transform your lifestyle, which plays a major role in combating the PCOS. Then secondly, you have to stop smoking, excess alcohol intake has to be avoided. Third, try having a good sleep, at least 6 to 8 hours in the night time.